Hi, I'm Kenny Anderson, Director of Multicultural Affairs for the City of Huntsville, and welcome to Impact. Always my delight to be here with you to share information about exciting things that are happening in our community, and of course today will be no different. She's not a stranger to this broadcast because she's been on before and she always comes with great information. Sonja Smith is here with us once again today. How are you doing?
I'm good, thank you. How are you?
I'm doing fantastic. Now, you are, of course, the project coordinator for Enroll Alabama.
Yes.
With the addendum there, AIDS Alabama, Project AIDS Alabama.
Right.
And I've never really asked you what that connection was. What is that connection?
Okay. Well, as you know, or might be aware, there are several groups that have applied for federal Navigator grants. And so AIDS Alabama was one of those applicants and was awarded such a grant. So that's how we're a project of AIDS Alabama. So we operate under the name of Enroll Alabama, but our main office is in Birmingham at the AIDS Alabama building.
Now, was the motivation because people who work in the HIV/AIDS arena are dealing with medical issues, so it was just a natural fit? Was it a collaboration? Because it makes sense to me, but I guess sometimes people might ask, what is that connection?
Well, I guess because healthcare is important to everyone, to people who are HIV positive and to people who aren't. And so I think the need to make sure that everyone was covered and able to receive their healthcare services, I think that was a great need that needed to be met.
And that population, right, and that population has lots of challenges too in terms of healthcare access and things like that. So
exactly,
it seems
funding
like
and
the perfect fit. Yeah, funding. That's right. It seems like the perfect fit. So I'm just glad you're here to enlighten us because we know nothing about Enroll Alabama in terms of getting that healthcare coverage. But by the time we leave here today, we'll know everything.
Hopefully.
Well, I said welcome back because you've been on the broadcast before talking about the open enrollment period for the Affordable Care Act. Mm-hmm. And that's essentially what we're talking about, making sure that people have access to health care.
Right.
And, you know, I'm going to date myself a little bit here. A long time ago when I first got out of college and I worked for a nonprofit organization locally here. I was a young person who had my whole life in front of me, and I was going to live forever. And so healthcare was just an extra burden for me. You know, it was something that, you know, was optional. I didn't want it taken out of my paycheck. And I'm not embarrassed to say this because I know a lot of people think this way or have thought this way in their lifetime. And I just didn't think about it. You know, I'm a healthy person. I'm living my life. Everything's good. I've never had an operation. I never had a major accident or hospitalization. And then I start experiencing life. And fortunately, I haven't had a major setback medically over the years. But I definitely look back and realize that my choice at that time was really not the best choice. It was the same as at that time when I had car insurance. I never had an accident. Mm-hmm. I now have legal insurance. I've never had a need for an attorney for a major situation. But you got to have these things because you never know when the need might arise.
Exactly.
And so we want people to understand through the course of this discussion why they need to sign up for health care. And it may seem like it's already understood because if you have health challenges or concerns, people are saying, well, I want to be able to make sure I got the right insurance to cover that. But you still have a lot of people that are asking questions and confused and scratching their heads. So help us clear that up right now. Talk a little bit about what your role is in terms of Enroll Alabama as you move into the community talking with people about healthcare coverage.
Okay. Well, Enroll Alabama really has two main objectives. One, to educate the community on the Affordable Care Act, and secondly, to help people get insured, help people get signed up for health insurance on the health insurance marketplace. And so we really take a grassroots approach to that, going into the community, meeting people where they are, being out where people can find us and where they can see us and come to us for assistance, and going to them wherever they might be.
Right. So, and I love the fact that you said grassroots because that kind of puts you right in the trenches. It puts you in line with people who may not routinely go across town to get information or dig deep into the weeds to really find out what's going on with a particular situation. But one thing we know for sure is that if you ever have to go to the hospital for something, you're going to want to have insurance in order to be able to do any kind of insurance, regardless of what the coverage is what I think in terms of my own personal needs. And so you're providing not just an opportunity for people to connect with the process, but more importantly, education. And I really wish you would talk a little bit more about that side of the process, because there's a lot of misinformation out there, and there's a lot of terminology being used. Even you used the word marketplace a few minutes ago. If you just kind of tell us what is the marketplace, because a lot of people talk about that, and what is it that people are shopping for when they're out there talking about, I'm using the marketplace to get health insurance.
Okay, well, the marketplace is, we might hear about healthcare.gov. And so the marketplace and healthcare.gov are pretty much synonymous. So when someone goes on the marketplace or goes to healthcare.gov, they're going to look at their options for health insurance within their area. So a person will go and put in their personal information, so their name, their social security number, date of birth, personal information, income. Then the system will calculate based on their income and where they live. The system will be able to calculate the amount of what's called tax credits or financial assistance that would be available to them. And that's really on a sliding scale based on household size and income. Once that is determined, that person can decide whether or not they want, how much of that money they want to apply towards their health insurance. And so the marketplace will give them 4 different categories of plans: bronze, silver, gold, and platinum. And those range in terms of premium or monthly payment. Bronze usually are going to be a little bit lower in terms of cost. Bronze and silver are a little bit lower in terms of cost, but they're going to have a higher deductible. So there's going to be more money that has to be paid in before they get the full benefits of the policy. And then there's also the gold and platinum plans, and those are going to cost more. So you're paying more on the front end, but they're going to get more benefits when they actually go to use those policies.
It'll come a lot quicker, too.
Exactly. So somebody who has a lot of medical needs is probably going to want to go for one of the higher, a gold or a platinum plan. Someone who maybe doesn't go to the doctor very often would want to opt for the bronze or silver. And there are some advantages to choosing the silver plan. That's a plan that the government is really driving people towards, so you do have more in terms of financial incentives if you choose a silver plan.
Now, there's a lot of pushback, obviously. People are saying, we don't want the government in our business, making these kinds of choices and decisions for us, that this should be a private matter, not something that the government takes a heavy hand on. There's been a lot of opposition to the Affordable Care Act, oftentimes referenced as Obamacare. And there are a lot of people that will simply say, I don't want to be bothered with that at all. What do you say as a person deeply entrenched in the process to somebody who may be skeptical and not really clear about why this might work for them, or why they may even have to do something like this if they don't have coverage?
Okay. Well, first off, as navigators, we really try to be as hands-off as possible. We let people know what their options are, and then let them make that ultimate decision. So we're not trying to sell anything on anyone. But when someone comes to us and they're a bit skeptical, then of course we remind them, it's just like having car insurance. You don't wait until after you have an accident to then call State Farm and say, hey, can I get covered? And it's the same thing here. You mentioned your situation, how you decided, you were invincible and didn't want insurance. And I was the same way for a while because it was just unaffordable. But it's definitely easier and much more cost effective to pay into a policy, especially when you can get the financial incentives. Pay into that policy now so that if something were to happen, that you would be okay and you wouldn't be in financial ruin because of the cost of health care.
And although some people may say it's a scare tactic, in some ways it's not a matter of if, it's really a matter of when. I'm very thankful, again, I've never had the major thing happen, but I'm aging and accidents do happen. And there are things that are beyond my ability to control that might put me in a health crisis, that I would need to have the kind of coverage that could sustain my ability to continue a good quality of life. And I think this is one of those quality of life issues that we need to be talking with people about so that they can better understand what's going on.
Definitely. And there are several people who just basic medicines weren't taking because they didn't have health insurance. And so the peace of mind that comes with having health insurance that's going to cover those medications, that improves a person's quality of life right there. There's also those people who, and if you have a family member, that's peace of mind for knowing that your children are taken care of, or that your mother or your father is taken care of. So definitely there's a quality of life issue that comes into play.
So you've been involved with this process for how long now?
Since the beginning.
Okay.
So this time last year is when the marketplace opened.
Mm-hmm.
So
Almost
yes.
about a year under your belt right now. How's it coming?
It's coming along really well. We were really pleased with the progress that Alabama had in the first open enrollment. We had about 97,000 people to have gotten enrolled.
Did you have a goal?
The goal for the state was 84.
Okay.
So for us to have exceeded it as a state is phenomenal,
Wow.
especially with the limited resources that we received and limited support, or no support that we received from the government. So we were really pleased with that. So it's happy with open enrollment that passed, and we're getting ready and gearing up for the next open enrollment, which starts on November 15th.
Right, and I want to talk to you about that in just a moment. I just wonder, when we talk about your 80+ thousand that you're shooting for, you almost hit 100,000, which far exceeds expectations, and with limited resources, like you said, in terms of support. As you talk to people and you talk to them about the basic services that are part of what comes with this coverage, do you find people saying this is something we want, this is something we got to have, this is something we're happy to know is available, more than people sort of, groaning and complaining about it?
The majority of people that reach out to us are happy to have it. There are a handful that are opposed to it, but at the end, 9 times out of 10, they've turned around. And there are some just really good benefits to having a plan now, because they're, like I said, certain medications are covered. When it comes to testing that you might have, or routine visits are taken care of. There's no copay for routine visits anymore. So it's really good to see the way that healthcare is changing and be a part of that.
And the pre-existing condition deal, where does that play in the whole process? Because that's the part that I start getting all excited and want to jump out my chair and start dancing when I think about that. Because,
Exactly.
I started thinking about that 10, 15 years ago and said, I'm not getting any younger. As I get older, I'm going to probably become more susceptible to something, and then somebody's going to tell me after all of these years of working and paying into the insurance process that they can't treat it because it's pre-existing. I mean, I was kind of like, whoa, wait a second. But what about that piece of the process?
Yeah, that part is what I think really draws people into the Affordable Care Act. I know for me personally, even a small biopsy that I might have had at 18 made the cost of insurance at 20, 25 just cost prohibitive. So now it's really exciting to see that if you've had any pre-existing conditions, that now you can get insurance. And pre-existing conditions or any type of health concerns aren't even a question that's on the application. So it's really great to know that, that's not a consideration when deciding whether or not you can get insurance.
Yeah. So now you're gearing up for open enrollment coming up in November. Obviously, you're heavy into the education aspect of this right now, because I'm sure you're moving around communities, talking with people about what's going on. Are you as happy talking to a room full of people as you are talking to maybe 4 or 5 people that show up at a community meeting?
Definitely, because those 4 or 5 are going to go and spread the word to a couple of friends, and then they're going to spread the word to a few more. So if it's 4 or 5, if it's 20, it's fine. Just to know that somebody has been touched and received the information is a positive to me.
Yeah. So from a logistical standpoint, as you begin to prepare for this rollout again, an open enrollment period that people will have an opportunity to sign up once again. They missed the window before, but now it's coming up one more time. It won't be long. They can go ahead and sign up. What's the window of opportunity that people will have this next go around?
Well, this next go around, the window is much shorter than it was the first time. So this year, open enrollment starts November 15th, and it will go until February 15th. So we only have a 3-month window. People who enroll between November 15th and December 15th will have their coverage to start on January 1st.
So that's a big incentive to get it done.
It is. So just like last year where the 15th was the deadline, it's going to be the same way this year. So someone who enrolls between December 16th and January 15th will have coverage on February 1st.
Okay.
So we really want to encourage people to start early with getting covered because you just don't have as much time as before.
Right. Is there a reason for the narrower window?
Well, I think it was longer the first time because it was new.
Yeah.
And so I think that the idea was to give people an opportunity to really for this to sink in for them. And they could think about things, they could mull things over. So now, since it's not new and this is the second go round, I think that the idea is that, okay, well, people know, they know there's a penalty. They know that they might be paying more money in April because they didn't have insurance the first time around. So we don't need to have as long of an open enrollment.
Right. Do you ever come across people that say, well, I'm not going to do it at all. I'm not going to get no insurance. I don't care about that. I don't worry if they penalize me or not.
Of course.
Okay. And well, how do you respond to that?
Well,
You just say, okay, I'm just here to kind of tell you your options and then let the chips fall where they may.
Exactly. I mean, all we can do really is to educate that person and let them know what their options are,
Right.
and let them know the repercussions of their decisions,
Yeah.
good or bad. So that's up to them.
Is it just the financial penalty?
Yes. Well, I mean, the financial penalty is the most obvious, and of course there are the penalties, the health penalties.
Yeah,
of
not taking
having
care of yourself or
insurance.
being at great risk of not having
Right, or-
health insurance and having a situation.
Exactly. I mean, that's the thing I think people don't really think about. And we get calls all the time for people who say they didn't sign up during open enrollment, but they've had something major to happen. They've realized that they had cancer. Something major has happened. And so now they want to get signed up. And we have to use that same analogy to car insurance. Well, when you have an accident, unfortunately, it's not like you can go back and retroactively get insured. You have to get it during open enrollment.
So that person who did not take advantage of that first open enrollment period and now they're anxiously looking forward to November 15th perhaps and has had something happen between now and then, there's nothing that can be done.
No, and there are special circumstances that somebody could enroll under a special enrollment period, but that's going to be like a change in household size. So due to marriage, divorce, adoption, having a child, or a significant change in income. Say you didn't have a job before and now you've recently gained one, and vice versa. Or if someone moves from county to county, then those types of, or release from incarceration, those types of life-changing events will enable a person to get enrolled outside of open enrollment and can do so now.
Yeah.
But anything other than that, they have to wait until November 15th.
Sure, and you wouldn't just go manufacture a life-changing circumstance just to get insurance. At least I hope you wouldn't.
You never know.
I think I'll have a kid, so I'll have be able to sign up. You just don't do that kind of thing. So you now have this opportunity for people to sign up once again. What do you need people to know about that sign-up process? Did they just go to the website? Did they go to a seminar that's happening in their community? If there are seminars going on in communities, how can people learn about those?
Okay. So there are several things for people to know. One is that now we have an additional carrier provider that will be available. So United will have the entire state.
Wow.
So we're excited about that.
Really?
United Healthcare has 11 plans that they're offering on the marketplace.
Well, that's new.
That is new.
Okay, good.
Including a health savings account option. So
Oh,
that's
really?
really exciting to see. So we have United and Blue Cross will have the entire state. And then Humana will have limited counties within the state. So Madison, Jefferson, Shelby, St. Clair.
And so people will be able to do a little more shopping this time.
A little more shopping, have a few more options, and it's okay. I think that's good. Still having it small is really good because people aren't overwhelmed with options.
Yeah.
And it's still something that's manageable and for people to be able to compare
Yeah.
in one sitting. So that's something new that we're excited about and we're letting people know. In terms of what's happening in the community, our Huntsville Navigator is working really hard to set up set up enrollment locations. So we will have a kickoff on November 15th. That's going to be a health fair / enrollment. And so we're really excited about that. We're also partnering with Huntsville Hospital a lot in this next open enrollment to provide ongoing enrollment sites.
So do you have the details for that yet, or are they just being developed still?
It's still being developed.
Okay.
We know that it's going to be November 15th, which is a Saturday from 10 to 2.
All right.
And we're working on the location.
Good.
But definitely someone could call our office, or they could go online to enrollala.com and they could get the details for that.
Okay, good. So you're engaged in a lot of things happening right now to get people ready, get them informed, and get them prepared to make these choices that they should be making about their lives, and that by law they need to do something with too. It's not an option. In the end, it's an option, but there are always consequences with whatever options we choose to exercise. So we hope that people will be smart and, first of all, learn more about what's available. I think that's one of the most important things they can do first. And of course, with the kinds of things that are available out there in terms of the companies, they can educate themselves as well about plans and things like that. This might be a curveball. If you don't know, it's okay. But do you know what state has the most options? I'm thinking of California or something, one of the bigger states.
California, I would probably say either California or Texas.
Yeah.
But they also had a lot of money that was given by their state government. So I think I heard that California had like over $1 million to just devote towards marketing alone.
Wow.
So when you have that kind of money to throw around, then you can really, you can really garner a lot of interest from insurance companies as well as the public.
So where do you think, and you've had a year now under your belt with this process, and will your organization have this process indefinitely, or is this a time-limited thing for your organization?
Well, like I mentioned before, that we are recipients of a federal Navigator grant, and that grant is a 1-year renewable grant. So we just received our renewal early in September, so we're excited about that.
Great.
So as far as we know, for now, we'll go from this point forward until middle of September in 2015.
Okay, and just keep chipping away with the education piece and the enrollment opportunities that people will need to have and take advantage of.
Exactly.
All right, so November 15th is the big kickoff. Big health fair somewhere here in the city. And there'll be lots of activity, lots of information, lots of encouragement, and a lot of support for people trying to get that kind of information.
Exactly, and like I said, we do have partnerships with Huntsville Hospital around North Alabama. So somebody could either go to our Facebook page, Enroll Alabama, or Huntsville Hospital's Facebook page or their website, and they could get information. But we're partnering with all of the Huntsville Hospital locations to make sure that people are covered.
Okay, that's good. And I'm really glad we had a chance to talk today because we're a little bit ahead of the enrollment period. This will give people a chance to even prep for that, because I think this show will probably air before that time, and people will have a chance to really start thinking about what they need to do. They can start having conversations even with their families, which I'm sure you all encourage that people do, so that as part of that education process, they can be more familiar with the options that are available to them.
Definitely. Have conversations with your friends, family, church groups, sororities, fraternities, co-workers even. Have those conversations with people to let them know. And because as we know, word of mouth is always going to be what's best in terms of marketing. So letting people know about open enrollment that's coming up starting November 15th. But then also if they want to help out and volunteer with us, we love to have volunteers, always need assistance.
Yeah.
So if they wanted to call us at 205-332-0175, we would love to get their help as a volunteer as well.
You never can have too many volunteers.
No.
Sonja Smith, thank you once again for coming and talking with us about open enrollment for the Affordable Care Act, and also just sharing some great information, I think, about Enroll Alabama, what the group represents, and how it makes an impact in our community as it relates to education and providing access to people that need it. Once again, tell us how people can contact you, Facebook, phone number, give them one more time that information.
So people can contact us on Facebook, Instagram, or Twitter at Enroll Alabama. They can also call us. Our main office in Birmingham is 205-918-8192. They can contact us in Huntsville. Trinisa Caldwell is our Huntsville navigator, and her number is 205-332-0175. Or they can email us at enrollalabama at AIDSalabama, all spelled out, .org.
All right. Thank you, Sonja Smith, project coordinator with Enroll Alabama Project, AIDS Alabama. Thank you for being here with us and sharing this great information with us today.
Great. Well, thank you for having us.
All right. Come back and, let us know what's going on.
Okay, great.
All right. We'll be back with another edition of Impact in a couple of days or so. And we'll be happy to share information with you once again about all the great things that are happening in our community. Thank you for tuning in today, and we hope to see you again soon. For Impact, I'm Kenny Anderson. I hope you have a great day.